Senator Cruz. My name is Nikki Moman, and I'm a nurse practitioner student at Texas State University. I wanted to take the time to talk to you about the provider orders for life-sustaining forms, also known as the POLST forms. In the state of Texas, currently, APRNs do not have signature authority over these forms. And patients who are suffering from life-threatening illnesses or elderly patients often want to choose their end-of-life interventions. Texas is one of the only few states in the United States that currently does not give nurse practitioners the authority to sign these forms. An APRN's inability to sign the POLST forms can cause the patient and the family undue stress and financial burden of trying to find a physician who is qualified to sign these forms, which is why I want to talk to you about this issue today. As you might know, the estimated population growth in Texas in the next 5 years is about 8.5%. Additionally, what's even more staggering is the population growth for the age group 65 and above is 21.5%. With the elderly population growth outpacing the total population growth in the upcoming years, there will be greater patient populations that will require POLST forms to be completed. At this current pace, the number of physicians in Texas will not be able to keep up with the demand of the POLST forms to be signed. This is already a challenge in counties that do not have primary care physicians. At the end of 2020, there was 32 counties representing about 117,000 people without primary care physician oversight. The elderly population represents about 13% of the overall population in Texas. This means that in those 32 counties, there are about 15,000 people in the 65 and above age group who do not have access to primary care physicians. This number will continue to grow over the years as the patient population grows, and this figure does not even include the critically ill patients who may be close to their end of life. It is important that there is enough supply of providers to meet the demands for the growing patient population. Nurse practitioners have undergone proper training and education in their professional careers and have added tremendous value to the clinics and hospitals in the state of Texas. It is also worth noting that nurse practitioners tend to have closer relationships with their patients than physicians as they spend more time during their visits. This positions them to work more closely with their patients and are the right fit to help them with their end-of-life interventions. This is a critical issue and it requires swift action from you and other senators. Today, I'm calling for action on this matter. The state of Texas must pass legislation soon to enable nurse practitioners to sign these POLST forms for their patients. This is an issue that must be tackled in 2021, and it already has the support of many professional nursing organizations. Ted Cruz, Senator, you can make a difference and help turn POLST program into law and give signature authority to nurse practitioners. You can help patients with adequate resources and allow them to make their end-of-life decisions and relieve them of the undue stress and financial burden. I appreciate your time today, and I look forward to seeing Texas make advancements in this area and join other states this coming year.